Welcome to the Broward College Associates of Science Health Science Navigator information session. The Health Science Navigator Associates of Science degree is part of the Health Science pathway and is an open access program. Open access programs allow students to enroll during any term. Aspiring health science students may select the Health Navigator Associates of Science degree upon registering at Broward College. Students can immediately start taking courses on the Navigator pathway that align with their chosen health science limited access program. This program is financial aid eligible for any student that qualifies. The Health Navigator program offers 10 specific tracks detailing courses that apply towards admission requirements for our limited access health science programs. Those 10 tracks include dental hygiene, diagnostic medical sonography, health information technology, nuclear medicine, nursing, physical therapy assistant, radiation therapy, radiography, respiratory care, and vision care. The college has also now established a generalist track for students who wish to pursue this exciting new career path of Health Science Navigator. Let's explore how this program design provides the best benefits to students interested in limited access health science programs. This program creates a win-win for students desiring to work in the rewarding field of healthcare. The visual decision tree displays a pathway to completion for students that do not apply to limited access programs or get formally admitted. If students do not get admitted, they can continue on and earn a technical certificate in Health Navigator Specialist, as well as an Associates of Science degree in Health Navigator. First, a student selects the track for their desired program, completes the pre-admission courses, and submits their limited access application to their program of choice. Then, if you are accepted to your chosen program, the health science admission team will update your major and you will complete the core courses and graduate from your program. However, if you are not accepted to your chosen program, you can continue and complete the remaining courses in the Health Navigator program to graduate with both a technical certificate in Health Navigator Specialist as well as an Associates of Science degree. Who is a Health Science Navigator? Let's explore. Patients can face complex issues related to their healthcare that require learning unfamiliar information and making difficult decisions that weigh heavily on them, often affecting their lives for a long time. A health navigator must be equipped with a variety of skills to provide the resources and comfort patients need. Health navigators must be able to communicate with a variety of people, from the patients and their families to doctors, nurses, and health insurance companies. They must serve as mediators or liaisons between the patient and those responsible for the medical, legal, and financial aspects of their care. The health navigator must be able to persist in challenging situations and be willing and able to find solutions through mediation and negotiation. Part of problem solving involves having great research skills because health navigators must seek out information that can help patients know and understand their rights. As mentioned, this program creates a win-win for students desiring to work in the rewarding field of healthcare. Students have the option to apply to complete the prerequisite courses for their desired limited access program. However, if they're not accepted to their chosen program directly, they can complete this degree in a few extra terms and still be prepared for a career in the administrative branch of healthcare. Let's explore some of these employment opportunities. Health navigators, or health education specialists, assist individuals overcome barriers to quality care. Some barriers include access to healthcare, insurance or lack thereof, poor health literacy, transportation, childcare, and more. Overall employment of health education specialists and community health workers is projected to grow 17% through 2030, which is much faster than the average for healthcare occupations. Our degree program also prepares graduates for medical billing and coding. Medical billers and coders work in a variety of healthcare settings, from doctors' offices, insurance companies, and hospitals. They can earn an average salary of $34,000 per year, which can increase with third-party certifications, such as the Certified Coding Specialist that our program offers. Many billers and coders progress to also become medical health service managers. Students who graduate from this degree can also become community health workers who promote health within a community by assisting individuals to adopt healthy behaviors. Like navigators, they serve as an advocate for the health needs of individuals by assisting community residents in effectively communicating with healthcare providers or social service agencies. They may also deliver health-related preventive services such as blood pressure, glaucoma, and hearing screenings, and/or collect data to help identify community health needs. While these roles are related, there's a major distinction that should be noted. Health navigators and community health workers provide direct community support for making healthcare decisions, while medical service managers and billers and coders tend to focus on facility and operational needs. Both roles play a vital part in the healthcare industry, and positions can be found in hospitals, clinics, and insurance companies. Within this program, students also have the opportunity to earn a third-party industry certification credential called the Certified Coding Specialist. This is awarded by AHIMA, the American Health Information Management Association. This national certification is important as it validates learned skills to employers and provides opportunity for advancement. In the last year, there were over 370 job postings requiring this credential with an average salary of $46,000. Coding professionals who hold the CCA credential have demonstrated coding competency across all settings, including hospitals and physician practices. Since 2002, the CCA designation has been a nationally recognized standard of achievement in the health information management field. Certified coding associates exhibit a level of commitment, competency, and professional capability that is valued by employers. They can demonstrate a commitment to the coding profession, distinguish themselves from others as having passed this rigorous exam. Some of the eligibility requirements include a high school diploma or equivalent. While not required, at least one of the following is also recommended: 6 months coding experience, directly applying codes, completion of this AHIMA approved coding program at Broward College, as well as completion of other coding training programs to include anatomy and physiology, medical terminology, basic ICD diagnostic and procedural codes, and basic CPT coding, which are all included in this program. Here are the most common health science foundation courses. As we review the next few slides, you will see common pre-admission courses. It is critical that the best grades are received in these courses for admission into our highly competitive limited access health science program. This foundation courses provide students with the option to be ready to apply to more than one of the limited access programs during their application windows. Here's a health science pre-nursing map. This includes both the prerequisite courses to apply to the nursing program, as well as the courses required to complete the AS Navigator degree. If your goal, for example, is to apply to the nursing program, you should not complete the courses shown with the numbers. If you are not accepted to the nursing program and would like to use your credits towards completing this degree, then you should work with your advisor to add the remaining courses to your academic plan. Please note that each track includes a letter that tells the college which limited access program you have chosen to pursue. So it is important that you include that letter in any program change forms and work with your advisor for best results. You can scan the QR code to view the most updated program maps for these degrees. Effective fall 2022 and beyond, students who plan to graduate from Broward College degree programs must demonstrate competency in civic literacy by successfully completing a specified course or examination. The two course options available for students to satisfy this requirement include AMH 2020, or History of the U.S. since 1877, or POS 2041, which is National Government. Students must earn a passing grade of C or better. These courses are both designed to prepare you for success on the Florida Civic Literacy exam. If you have already completed one of these courses, then you will need to only sit for the Florida Civic Literacy exam to satisfy this requirement. A passing grade of 60% is required. Several testing options are available to students to satisfy this requirement. However, the Florida Civic Literacy exam option can only be taken locally at a campus testing and assessment center. If you choose to take the CLEP American Government exam, you will need to request that your scores be sent from the College Board directly to the Broward College Registrar's Office to satisfy both the course and the assessment requirement for graduation. Effective fall 2022 and beyond, students who plan to graduate from Broward College degrees must demonstrate competency in digital literacy by successfully completing a specified course or examination. The course options available for students to satisfy this requirement include CGS 1060C or higher with a passing grade of C or better. If you have already completed a related course, please speak with your assigned advisor to determine if you have satisfied this requirement. Students can also take the CSP or CLEP exam to meet this requirement. However, the CSP option can only be taken locally at a campus testing and assessment center. If you choose to take the CLEP Information Systems exam, you will need to request that your scores be sent directly from the College Board to the Broward College Registrar's Office to satisfy both the course and the assessment requirement for graduation. Let's review a few frequently asked questions about this program. Will the AS Health Science Navigator degree be considered a limited access program? The Health Science Navigator degree is part of the health science pathway, but it is not considered a limited access program. Students may select this as their primary objective on their application and start courses right away, regardless of their desired program. Does completion of this program guarantee that I will be admitted into a limited access program such as nursing? No. The only guarantee is that the prerequisite courses for that program will be completed. If a student chooses to follow this specific track and apply to the limited access program, they must still meet all of the other admission requirements for that program before applying. Applicants for limited access programs are selected based on seats available and applicant ranking on a point-based system. In addition to preparing students to apply to limited access program, this degree offers aspiring health science students an alternative path to completion. What types of students should select this program? Again, patients can face complex issues related to their healthcare that require learning unfamiliar information. A health navigator must be equipped with a variety of skills to provide resources and comfort to patients. Navigators must be caring. A desire to help patients and their families is the most important asset in being a successful health navigator. Orderliness. A health navigator must keep detailed records and notes about each case, and documentation of follow-up calls with the patient and others is involved. Perseverance. A health navigator role requires strength and patience to handle what patients are experiencing and expressing to them. They must stay positive so they instill trust in the patients who rely on them for advice and quality care. The AS Navigator course content includes, but is not limited to, communication skills, leadership skills, human relations and employability skills, principles of health insurance, computer literacy, healthcare organization, medical ethics, legal aspects, and health and safety. As a reminder, upon graduation, students are also eligible to sit for the AHIMA Certified Coding Specialist exam. To avoid delays in graduation, students are encouraged to meet with their assigned advisor frequently to ensure that they are completing the correct courses for their desired program. Please note that the technical courses shown are not required for admission to limited access programs. They are only required for students completing the generalist track. Prior to taking the HSC 2810 Healthcare Navigator capstone in the last term, it is required that students participate in seeking out their own internships. Students should begin to identify potential internship locations 3 to 6 months before the start of their course. A letter from the planned internship facility needs to be approved by the Health Navigator Associate Dean or the capstone faculty before making the internship commitment. Please work with your assigned advisor for more details on preparing for this internship, as a background check and drug screening is also required. International students have a limited number of online and blended courses they can take per semester and should fully understand the requirements of this program before registering. It is highly recommended that international students review the program as well as their individual academic plan with their assigned advisor, as several courses are only offered online and only offered during specific semesters. Failure to take these courses in the appropriate order can impact an international student's ability to complete this program. We've covered a lot today, but if you still have questions about the Navigator program or extra specific questions about the prerequisite courses required for our limited access health science program, please scan the QR code to attend a virtual information session where we can answer those questions for you. Register to join us to learn more about these programs. It's also strongly recommended that students speak with their assigned advisor before registering for courses and/or making program changes. Thank you for choosing Broward College. We look forward to celebrating your success.